Hello, my name is Jared Schenfeld, and it is a pleasure to speak with you all. I am with the Colorado Department of Public Health and Environment here to provide ways to fight obesity and diabetes. Over 42% of Americans are obese, and over 11% have diabetes, a number which is growing rapidly according to the CDC. Thankfully, this problem can be treated, prevented, or heavily reduced by lifestyle choices. We are going to focus on one mechanism of these diseases for treatment, balancing glycemic load to stabilize blood sugar. Now, before we suggest how you can balance your glycemic load, we want to discuss one of the most popular and new medications for diabetes or obesity, Ozempic. This medicine stabilizes your blood sugar and is for many Americans the first line of treatment for these diseases. This is attractive as you can take this injection and have it help your disease regardless of behavior change. Though, in the Medical Journal of Diabetes, Obesity, and Metabolism, the Step 1 study group tested what happens after you go off this medicine. After 68 weeks of use and then 1 year after stopping the medicine, the average participant regained over 2/3 of the weight lost. Now, it is important to remember that everyone can fight obesity and diabetes. Medications might or might not help fight these diseases in meaningful ways, but as the Step 1 study group found, they might only offer short-term benefits and could come with unwanted costs in the future. For those who can't afford medication and do not want side effects, there is an easy and natural way to prevent diabetes and obesity: balancing your glycemic load. Balancing your glycemic load is simple. It is eating food in a way that balances how it is absorbed. Everyone loves chocolate and sugar, but we all have experienced how horrible we feel after eating a bag of M&Ms by itself. We suggest 2 simple ways to be able to eat foods like M&Ms without a large rise in blood sugar. According to the American Journal of Clinical Nutrition, eating only a single piece of candy will produce only a small rise in blood sugar. This is due to the one candy only containing a little bit of sugar, even though candy is generally known to largely raise blood sugar when consumed in larger portions. This means you can eat sugary foods if you eat them in smaller portions. Alternatively, you can also balance this blood sugar rise by eating the M&Ms with equal amounts of protein and fat, either with carbs shortly before or after. This causes your body to absorb the carbs slower and cause a more stable rise and fall in blood sugar, balancing your glycemic load. This allows you to eat a larger portion of carbs if you balance your portion of carbs, protein, and fats. These are the 2 ways we suggest balancing your glycemic load. Balancing glycemic load can aid weight loss, lower blood pressure, lower cholesterol, improve blood sugar management, and lower the risk of diabetes and obesity generally, all according to the Mayo Clinic. In the past few years, for the European Association for the Study of Diabetes Clinical Practice Guideline creation, 29 high-quality studies were analyzed and found more stable blood sugar levels, lower cholesterol, lower participant weight, better blood pressure, and less inflammation in people who ate a low glycemic diet, regardless of use of blood sugar medications. And these benefits remain for as long as people continue to balance their glycemic load without regaining any weight loss, which pharmaceutical drugs like Ozempic can unfortunately cause. In the end, this means that you can eat sugary foods, but you need to pair them with protein and fats. This balances your glycemic load and keeps your blood sugar regulated and stable. Moderation is recommended because the amount of sugary foods you eat still matters and should be monitored. Overall, making these small and simple lifestyle changes will improve the condition of obesity and diabetes in those afflicted who make these lifestyle changes. Thank you all and have a wonderful day.